I gotta ask, when I found you, you're called the Dick Daddy at Youthology. How did you get? I mean, maybe it's obvious. How did you get the name? It's super cool. I think I laughed for like 15 minutes. I was like, this guy gets it.
Welcome to the Men's Health Unscripted podcast with Patrick and Cam.
We're focused on everything on men's health. Look at your emotional, your physical, and your spiritual well-being. You're going to take care of that and make sure you keep on going.
What's going on, guys? It's Pat and Cam, and here we are here with the Dick Daddy, Dr. Jason
Big man,
Rupeka. We're excited to have you on, Dr. Jason. I think this has kind of been a long time coming. We've exchanged some stuff online. So how you doing? Thanks for coming on the Men's Health Unscripted podcast. I know you work with a lot of men and stuff, so it'd be good to see your perspective on medicine and how you practice.
Sure, I appreciate you guys having me, and yeah, I love doing podcasts. It's a ability to talk about some of these procedures and what we do, and some of the more cutting edge medical things that are going on that Instagram and social media just don't really allow you to talk about as much anymore.
Oh, really? Have you found that social media kind of shuts you down, or it just doesn't kind of spread, your message or what you're doing for your patients?
Yeah, I guess a little of both. I think that, doing any type of cosmetic medicine or just medicine in general gets, in the age of AI, it gets mixed in with just accidental nudity and opinion posting and things like that. So it's harder and harder for us to post, like, say, just even a before and after. They kind of flag a lot of those because it seems like you're making fun of people with bigger noses or smaller chest or whatever. The men's stuff, especially the penis procedures, are extremely hard because most people want to see results and things like that, and you can't show that out in the open. So yeah, I mean, we're constantly finding new ways to advertise, basically. So the podcasts are great. In my procedure, especially like with the male enhancement, most of my patients find me through Reddit and through message boards like that. So that's kind of interesting, and we've been working a little bit more with those types of entities.
And that's super interesting with Reddit being, stringed on discussion posts and things like that. I guess it also kind of reflects something I was thinking about when you were talking about some of the other social media platforms where you only get a short term, you can only put little videos or clippets out to kind of show things or photos with a small description because, everybody's attention span is kind of small. Whereas a podcast, you get a platform where you get like 45 to an hour, even more minutes to kind of discuss and even further explain how things are working. So I guess Reddit kind of follows that same suit too, where you kind of type out and discuss things rather than just 15 seconds of click.
Right. And like things like liposuction procedures, things like that on when you put it on some of these platforms where you have 60, 90 seconds, everything's so sped up, it makes all these procedures look a little bit more barbaric and it kind of, defeats the purpose. It's almost scaring patients. So, yeah, so I appreciate you guys having me. I've been checking out your other podcasts you've done in the past. And I think that it's a cool, like, platform message that you're trying to delve into more of the guy side of cosmetics, because I think in my practice, it's probably still women heavy, but we're treating way more men now than we were 3 years, 5 years, 7 years ago.
For sure. Yeah, we've kind of dove into the aesthetics more recently. It's just been a really growing field. Our mission here with Men's Health Unscripted is to give guys options. I mean, we're not particularly biased towards any one thing. What works for one person might not work for somebody else. So giving people the options, putting them in connection with somebody like yourself who is doing these procedures, who has a lot of experience and can articulate these, kind of what you're going through. And Cam and I are both pharmacists, and so we've been in medicine for a little bit. If you've never seen a surgery done, it looks brutal. And if you haven't seen those kind of procedures, it can really be kind of graphic and almost like a crime scene sometimes.
Yeah.
So I think kind of giving people a little bit of education kind of pulls down some of the barriers and saying like, okay, that might be for me for whatever purpose. And that's kind of why we're here. Let's kind of dive into a little bit about your practice. How did you get started in aesthetics? And then kind of when did you maybe notice the kind of uptick in men seeking out your services and other types of procedures?
Okay, so I started to make a little bit of a transition, mostly on my wife's kind of impetus, just because that was starting to trend in that world around like 2015, 2016. I think the Kardashians were kind of coming out, the housewife shows, and it's like anything. I think that in aesthetic medicine, there's an art to the procedures and the results. And I started to dabble in it, and then after several months, I just realized, hey, I'm pretty good at this. I'm getting good results. Patients are happy. That part of my business is growing, and then to be honest with you, I had a month where my accountant called me and she's like, wow, your aesthetic business did better than your medicine practice last month. And I was like, holy shit, like, you serious? I'm not even really trying, and then it just kind of happened again. And we made a conscious decision, because I've been a firm believer, if you're going to do something, you need to do it. You can't do something halfway and then expect to get good at it. So we closed down my practice and focused straight on aesthetics. That was about in June 2016. And like I said, from the beginning, it's been a lot of female patients. Youthology is actually, the name of my company is actually Youthology Regenerative Medicine. So we've taken an approach to aesthetic medicine from the get-go on just regeneration. We use mostly collagen biostimulator products. I do a lot of fat grafting, a lot of nano fat. Now we've delved into the hormones and the peptides and the bioidenticals, but it's been like that from the start. And I would occasionally see some guys for the same things as girls: volume loss in the face, wanting to look younger, wanting to look healthier, a lot of sunken eyes, just the normal things that probably people are seeing in the mirror when they're hitting their late 30s, early 40s and beyond. About 4 years ago, right before COVID, my practice took a bigger swing in the body modification department. So we started doing a lot more liposuctions, a lot more skin tightening, skin regeneration. And then it's been kind of snowballing more towards men since then. And then eventually that led into the genital enhancement. And now I think, I don't know for a fact, but I think I'm probably the number one doctor in the country for doing male genital enhancement. We do about 10 guys a week, and I've been doing 10 guys a week for 3 years now. But yeah, so my practice is kind of, it's been kind of a cool process because I had a medicine office for 11 years before we flipped over into aesthetics. So the growth was very organic, but where our space is now, I spend about 3 days a week doing body modification, body enhancement, and 2 days a week doing face injecting. But like I said, we work with mostly biostimulators at Youthology.
That's awesome.
Could you explain exactly what a biostimulator is for everyone listening? Just
Yeah.
some background on it.
Yeah, so there's like if we're using just basic products in the face, say there's neurotoxins, which is your Botox and your Dysport, and those are going to be paralytics. They're going to paralyze muscles so you don't make wrinkles. And then if you're not using neurotoxin, you're using some kind of quote unquote filler. And most filler out there is hyaluronic acid, which when these companies make these hyaluronic acid fillers, they dehydrate them in a lab so that when we inject them into the skin, they hydrate themselves and they fill, kind of like spray foam insulation or caulking, basically. Those products don't do anything to tissue, to the skin tissue or the subcutaneous tissue. So in 2006, the FDA approved polymethyl methacrylate, which in the United States is called Belafil, and in 2007 the FDA approved polyl lactic acid, which is called Sculptra. Those are the two main biostimulators, and what those do is that PLLA, which is Sculptra, or PMMA, which is Belafil, gets injected into the tissue, and our body elicits an immune response. Our macrophages engulf that molecule, and it forms basically a collagen network around it. Type 1 collagen about 40%, type 3 collagen about 60%. And that process happens over about a 25-month period after we inject the product. So these medicines are a little bit different than fillers in the sense that, yes, they will fill a space because there is volume to them, there's mass to them, but they're mostly enhancing the collagen composition of whatever tissue we're injecting it in. So it makes tissue healthier, like literally quite younger, which is plumper, which looks healthier. So they're called collagen biostimulators, but they're essentially tissue builders. Say if we were seeing a new patient for the first time and say they didn't like the way their upper arms looked because their skin was crepey, their skin looked old, or their arm looked old, we would physically inject their arm with these collagen stimulating tissue builders that'll just add so much collagen to that area that area will just look younger because it is literally younger tissue almost. So So it's kind of a form of biohacking. It's super cool. And like I said, these products have been around almost going on 20 years, but they've really been thrown in the forefront these past 3-4 years in aesthetic medicine.
I think the falafel is kind of something that's been new for us just because we've been seeking out professionals to kind of describe a little bit about what goes on in these procedures. We've heard of it before. And then as far as like the collagen stimulating kind of products, are they limited to a certain area of the body? I mean, I know that some guys get injected in their penis and like you said, can be in the arm or anywhere like that to kind of regenerate that old collagen. Do you have any limits with those type of procedures?
No, I mean, I would tell you that on the just as a broad generalization, because they tend to heal a little bit more unevenly as the product gets integrated into your tissue. We wouldn't use them in, say, like the lips or the under eyes, like areas where the skin's real thin. But saying that, I do use them a lot in the vaginal tissue and a lot in the penis, and the skin's very thin there as well. I just think it's not out in the open as much where, people can quote unquote hide that while it's healing. But no, we use for Belafil, for instance, I'm the number one injector of Belafil in the world for the past 4 years, and we average about 450 syringes a month because we use them all over the body. Every patient, no matter what age, we start young patient, because these biostimulators last in the body like 5 to 10 years, whereas a filler lasts 6 to 12 months. And Botox lasts whatever it lasts 2 to 4 months. So I think that like most people want to look natural as they're getting any kind of cosmetic enhancement for the most part, and guys especially want to look natural. They don't want to look like they went and got Botox and then they go to work at their job and have to explain to their friends why they have 2 black eyes and bruises on their forehead. So
can't always claim Fight Club either.
Yeah, right. You can only say shit fell out of the cabinet so many times.
Right, I fell down the stairs.
When they start wondering if your life is one of those crazy commercials, like Tupperware is firing out at you all the time.
Right. I think that like cosmetic medicine in general was, for the most part, a lot of the procedures were taboo until maybe 7-8 years ago. And now that things are more, common, like the guys are just coming around a lot more than they ever have. Same thing with younger patients. We're seeing more and more patients that are younger, not necessarily to make big, modifications, but just kind of small tweaks and things that, maybe bothers them a little bit, and you can give them a little bit more self-confidence, doing something small like that. So I think we're going to see even more and more of that now that, semaglutide is so big right now. And I think a lot of the peptides are growing. I know in our practice, we're prescribing more and more, BPC 157 and just, some of this tissue growth factors and hormone therapy, all that. Sure. You guys a lot of exposure with like biohacking on the podcast before?
A little bit. We have discussed peptides a little bit in the past. I was actually going to kind of lead into my next question. What are some peptides that you've noticed that provide some real benefit to your patients? And like kind of maybe what are some of the mechanisms of those peptides? I know there's, you can think of like growth hormone or something like that, but the peptide game is just getting so much more refined. So maybe you could help us out with that.
Yeah, I think so too. And I think that like, if you try to start researching peptides, even for myself, it gets overwhelming because it's like learning a whole new form of medicine, even though, we're trained in medicine. And it's just something in medical school residency, even in my private practice, you never really got much exposure to that type of stuff. And so we do, like I said, we do a lot of procedures. So we use a lot of BPC, a lot of the insulin growth factor derivatives, just things that like are more anti-inflammatory healing. And we put patients on those after some of the procedures just to help their body's inflammatory response. So we do a lot of those. Obviously, like guys that are on testosterone or girls that are on bioidentical hormones, they like to use the growth factor derivatives, growth hormone derivatives as well. So, like we try to start kind of simple. We try to start on like a tissue builder or an anti-inflammatory. And then, as patients kind of get used to it, branch off from there. The peptides are a little bit cumbersome because they're mostly injectables, and, you're giving somebody like 2-3 medicines that they have to inject, some every day, some a couple times a week. It gets a lot after a while. So try to make it as simple as possible for patients. But I think we prescribe a lot of NAD, a lot of NADs more for cellular aging. But some of these peptides, you have to sort of like trust that they're going to do what they're doing, because it's not like like an Adderall or something where you're going to take it and notice an immediate difference that day. You have to kind of just hope. Same thing with the biostimulators, for that matter. We inject them and they grow over a 2-year period inside your body. Like, you have to sort of believe in the process. Like, that's where it helps as a provider to have a lot of before and afters and things patients can look at, because you're not going to notice an immediate difference from one day to another, which patients like, right? They like that they're not going to look completely different right away, but they also want to make sure they're getting something for their money, because everything's expensive in this world.
Mm-hmm.
True.
Belafil, the polymethyl methacrylate, or PMMA, is like the consistency of a fine powder. So when we inject it, since we can't inject that powder, they infuse it in a bovine collagen gel matrix. So there is volume to it, but your body will absorb that cow collagen gel in the first like 4 to 6 months before that PMMA starts to build collagen around it. So when we inject people, you will get an immediate result. And then, that kind of like helps you see what the end result's going to look like as those products build themselves and, within the tissue, which is nice. Poly-L-lactic acid is mixed in water, so it doesn't have that same effect. So that's how we kind of use them interchangeably, depending on where in the body we're injecting them.
Have you noticed, like kind of in your practice, that there's been an increase in a certain, peptide? Like, patients have been going out doing some Google research or whatever, and they're like, "Hey, Dr. Jason, I really heard about this peptide. Can you get it for me? Do you offer it?" Is there anything in particular there that you've noticed, kind of an influx?
I would say that the biggest peptides that we prescribe are NAD and BPC 157. So I think BPC has the most information out there, because a lot of girls take it for bowel issues. And, in my experience, most girls have bowel issues. And, the first thing that pops up is anti-inflammatory. And so we prescribe a lot of BPC. That seems to be the one, that and probably NAD are probably the two that people call and ask if we prescribe. And then after that, it's, like I said, CPK, TB500, these ones that are more growth factor derivatives. I still think that people want, if they're looking into biohacking or looking into starting on something like that, most of them want to start on a hormone. Most guys want to start on testosterone. Most girls want to start on, either a form of testosterone with estrogen. And then the peptides kind of come after that, I feel like.
Do you guys go for like a very specialized approach, or, a lot of docs are just like, "Oh, you have low testosterone." I guess what I was going to ask is, like, do you explore different dosage forms? You tell them like, "Hey, you got the cream, you've got injectables," right, all kind of things like that. Or, have you noticed that patients just ask for a certain thing, they feel comfortable with injections? Personally, and that's not my cup of tea. I don't like shots, but there's people out there that don't really mind it.
The medicines that we get are they're all pretty much coming from compound pharmacies. So most of them have the ability to give patients options if they want. There are some variations that obviously are going to work better for certain things. Like if a girl's taking BPC 157 for IBS symptoms, then we'll prescribe them the pill, because that tends to hit the gut better than the injectable or the cream form or the troche form. So, I guess it just depends on, the patient. But sure, like yourself, there's a lot of patients that have trouble sticking themselves with the needle, and we look for options for that. But I feel like most patients don't mind. If the advice from us is that this certain medicine at this certain dose, timetable, delivery route is what's best for you, then they're pretty agreeable. The space that we work in, outside of the insurance realm is really kind of nice, because you can have those discussions with patients and they can do what you talk about. In the insurance world, you're having a discussion with a patient and they go about, Lipitor, and they go to the pharmacy and it gets changed to Zocor. And then, what you talk to them about has no bearing on their new medicine that they're taking. So I feel like that, in this like space with patients paying cash and, and taking the insurances out of the equations, you have a little bit more autonomy to talk to them about the different dosages. And you're right, like everybody's more informed nowadays. Like they can look up all this stuff and they listen to podcasts and they go to conferences and so sometimes that makes your job easier, sometimes it makes it a little bit harder because everybody's an expert.
Right.
Yeah, like you talked about, working outside of that insurance window is actually kind of key, kind of crucial for a lot of patients now. Insurance definitely is needed. It has its place. Some of these procedures, when you get to conditions like cancer and things like that, will be astronomical costs. But
Right.
some of the stuff, especially when it comes to some of the cosmetics and things like that, it's not covered by insurances. Testosterone's starting to get really weird with insurance too. Some places are limiting the dosage or limiting the formulation or limiting how many vials they can get, or there's all kinds of weird restrictions they place on it. And a lot of patients don't understand it. And unfortunately, obviously that becomes a problem later on because they'll get the therapy prescribed to them. They'll be comfortable with it. They'll be excited to start it. And then they get to you and you're like, yeah, your insurance doesn't cover even brand specific. Like, oh, they don't cover the Alcorn. They only cover the Tevia or whatever the branding may be for it. And it becomes such a hassle. So when you're outside of that realm, it is nice because not only are you able to have like that understanding and flexibility with therapy, now the patient can be comfortable with like, oh, I understand it's not going to be covered like this. This is going to be what I'm going to be paying for it, or these are my options to find, better pricing or even a product that might be comparable, different route, better price, things like that. So
Right.
It kind of gives us the flexibility, and that helps with adherence as well, especially when it comes to injections.
Yeah, I think so. And getting back to the guys, what's really nice about my male patients is male patients come in, believe it or not, a lot more informed than my female patients do. I feel like when guys finally make a call to make an appointment and come and see us, it's because they've done the research or they've, asked questions on a Real Self or a Fallow boards or one of these message boards or a Reddit subreddit. So my guy patients are actually my favorite patients because you really don't have to be a salesperson with them. They kind of help you out with, what they're comfortable with, what they've researched, what questions they have. So yeah, it's actually really nice. Like medicine mostly is helping people, that are sick. Like this form of medicine, aesthetic medicine, the longevity, the biohacking's really great because my patients are healthy. They want to get healthier. They want to, live longer and look better. So it's a really cool space to work in.
That's awesome. Yeah, just to kind of like build off what you guys were saying too, is plus insurance. I was actually talking about it last night in a men's group. The insurance approach is generally like algorithmic. So it's like this step, this step, this step. And then like finally you get to maybe the one that you want or the one that or think is going to work. The cash pay model, yeah, it can potentially get expensive, but at the same time, just like you guys said, you're getting the treatment that the doc said that you're going to get. And there's really not a lot of in between, or like you don't get bucked off a situation or something. So it is kind of nice to hear that people are able to ask for certain treatments. I know TMS has gotten really big in the past few years. And I think, Cam, you can correct me if I'm wrong, because I know you were kind of in it a little bit more than me, but you have to fail one or two of these medications for mood in order to get the prior authorization for TMS. And now a lot of places are just offering TMS as cash pay. It can become first line for you. So having other procedures like that, that you can just go straight to can be really beneficial for a lot of people.
Yeah, for sure. And like with insurances, when you're talking about like the TRT and those types of medicines, they're using these lab parameters, but lab parameters don't work for everybody. They don't work for men versus women versus, 65-year-old man versus a 45-year-old man. So, that's where when people ask about running into their insurance, it gets so daunting to deal with all that most people don't mind paying a little bit extra, if they have to just get the medicine that you prescribe and the dose you want and the way that you want it to deliver it.
And sometimes, and honestly, the cost is actually, it may come out cheaper because depending on how many steps are in that flow chart, you're paying your insurance premium already. So that could be, substantial a month. And then you have to now try step one. So maybe you're on an oral medication that you have an out-of-pocket cost, copay, $10 or whatever, that's fine. But you got to trial it for 3 to 4 months. And if it doesn't work, the next medication, the same situation, they may be another second line, they'll trial 3 to 4 months of oral medication. So you're paying for those fills every time. You're paying for your premium all the same. So come time where you finally get that option where they're willing to do the prior auth and cover that other therapy, you may have already paid the out-of-pocket cost that would have costed you to start off from square one. So it's definitely something to consider when patients are looking at this stuff. So, our listeners, make sure you're reviewing your insurance information, kind of look through. I know we all kind of just click those options when we're going through it, but review those things, because sometimes that costs an add up. And if you could just pay out of pocket, a lot of places offer payment plans, up front, you'll get what you're looking for potentially at a cheap or even equal rate as what you're gonna pay anyway.
Then when you start using like the medicines that we do to improve the patients cosmetically, they're kind of the same way. Like you're paying a little bit more up front to front load these medicines in there, and then as time goes on, you're kind of like doing smaller tweaks, and then you'll get to a point where everything looks great, and those products last a long time, and they're really kind of cool. Like if you're taking a patient and we say like I liposuction their belly, and I take that fat and I put it in their butt, for instance. Down the road, if that patient starts doing fitness competitions, drops their body fat percentage down, they're going to lose a lot of that fat, no matter where it is. Like, but the tissue biostimulators actually get better with things like that. So a lot of people are opting for more of these tissue builders, collagen biostimulators, rather than doing fat grafting, just because they get better the healthier you are. They don't quote unquote go away with weight change. I guess the point I was trying to make is that, like they're expensive too. And patients have to just realize that anytime you're talking about any of this stuff, it's an investment in your health. It's an investment in yourself, and it's an investment. Sometimes a pretty decent investment.
Yeah. And no one wants to take that time and investment to build a dump truck and then get a flat, going out to the gym every week.
I gotta ask, when I found you, you're called the Dick Daddy at Youthology. How did you get? I mean, maybe it's obvious. How did you get the name? It's super cool. I think I laughed for like 15 minutes. I was like, this guy gets it.
It's funny. Like I have, when I started out with my practice, girls started calling me the lip god because I can inject lips very well. And so I went and got lip god trademarked, and that was maybe 6 years ago. And when I started seeing more guys doing more of the penis enhancements, the one guy told me that somebody was calling me Dick Daddy on a subreddit somewhere. And I'm like, holy shit, that's catchy, So I called my lawyer. I'm like, can we trademark Dick Daddy? And he's like, I think we can. He's like, we probably have to, change the I to an exclamation point because they won't trademark a swear word or whatever. And I'm like, yeah, fuck it, do it. Like, so it's funny now because now we push, that Dick Daddy, it travels a lot better than lip god. It's crazy. I had a patient I saw last week. She's from Pittsburgh, and we're outside of Cleveland, and she's like, I told my husband I was coming to Youthology today, and he goes, "Oh, you're gonna go see the Dick Daddy?" And I said, "See, that's working. It's growing."
She didn't even have one, but she's coming to check it out.
So, I mean, I'm sure there's people out there that hate a doctor calling himself Dick Daddy, and it's maybe a little unprofessional, but whatever. Our practice is we're pretty casual, and you have to make patients feel comfortable. So we have Dick Daddy hats and Dick Daddy shirts and Dick Daddy swag.
That's awesome. Well, from Men's Health Unscripted perspective, we love the Dick Daddy name. I think it's awesome.
Thanks.
Oh yeah, it definitely fits about a logo.
I've always considered myself one of these doctors that kind of is a little bit of an outside of the box thinker. And, when we started Youthology and I started my Instagram, instead of marketing towards the older patients with disposable income, I went towards the younger patients because I felt like I connected with them better. I had like a little bit more of a dry sense of humor in my personality. And then, it ended up working because I would get those younger patients and then they would bring their mom or their, older aunt or their older sister in. And I ended up getting all those older patients anyways. But with the male and the male enhancement, I see about, I don't know, maybe under 20, but patients that are in movies. So male actors in the adult industry. And the one last year was like, have you ever thought of going to any of our trade shows? And I said, no. And he's like, I think you do really well there. He's like, there's mostly actors and actresses. And outside of that, it's thousands of horny guys and guys that are looking for, help in areas like that. So we're actually going next weekend to an adult expo in Manhattan for movie actors, for the cam people, for sex toy companies, for all that, because I figure, why not? Like, I'm going to go and advertise my dick procedures and my vaginal enhancements and stuff out there. So we got, I had those inflatable guys with the arms waved, like that they have at auto lots made, but two huge penises. So we have giant 9-foot inflatable wavy penises, and we got Dick Daddy bottle openers and koozies and all that shit. So,
man, I love it.
Vouch for the koozies. I love the koozies.
Oh yeah,
I'll send you guys some stuff down there.
Cool, thank you. Yeah, we do koozies as like one of our giveaways, like stickers, koozies, all this stuff. Koozies kill it every time, and it's like people keep it. Nobody throws a koozie away.
No, but I'm embracing the, I mean, not to be whatever, but from a business perspective, the men just spend more than women when they come in to see our procedures. And it's really, to me, it was counterintuitive, because a lot of girls come in, they're like, oh, my husband's so mad, or my boyfriend doesn't want me to come here and do this stuff, he thinks it's a waste of money. But my guys that do come in, I feel like they treat their body in a way like they treat like a sports car if they had it. Like they don't mind spending whatever it takes to get this part of their body looking better. And so I think business wise, about a year and a half ago, I made a conscious effort to just market more towards guys, because in the med spa, the plastic surgery industry, I feel like there's not a lot of doctors that are marketing towards men.
For sure.
So we have our office set up a little bit more, I don't want to say more masculine, but it's a little bit more masculine, for lack of a better word.
And like this background, this is like your regular office space here?
No, I'm in my bar room at my house.
Oh, okay. Because I'm about to say, this is definitely really kind of more triggered to that, even the wallpaper.
My guys that come in, some are a little bit shy just because maybe they're new to doing things like this. And, we try to make them more comfortable. So we have just spaces to where it's not them sitting in a, room full of women and, wondering why they're there and things like that.
So with like the penile enhancement procedure, I know from what I understand, it's like a bunch of little micro subdermal injections. Is that right? Or is that one of them?
Yeah, that'd be one. If you were using HA filler, you would probably do it that way. Like I kind of explained it to my patients. Most of our penis is made of erectile tissue. And in that erectile spongy tissue, that's where most of our nerves and our blood vessels and our urethra go through. And then wrapped around all of that is a fascial layer called Buck's fascia, connective tissue, fascia, whatever you want to call it. And then the skin on top of that. The way that I do my penile enhancements is I make my little numb spots around the penis wherever I'm gonna make a port for my cannula. We use cannulas. So a cannula is like a 2-inch needle, but it's a blunt tip, so it doesn't have a tip. So we have to use a needle to pierce the skin, and then the cannula slides through that hole. But I'm layering the product on top of Buck's fascia, but under the skin. So I don't do micro droplets, because you can't really inject biostimulators in droplet form like that. If you do, they'll kind of ball up in those areas. So we do more retrograde injecting and do linear threads. So I'm going to do a fanning technique where I'm going to retrograde or inject while I'm pulling back on the cannula under the skin on top of Buck's fascia. And I'll crisscross it as many different ways as I can to just make sure that there's like a good collagen fiber mesh network under there. So generally, like if you came in and I injected your penis, you're going to leave with maybe 5 or 6 little needle holes where I had to make a port to have the cannula go through. And then that's where I use Bellafill. There's something else called a P-shot that we do a lot of. And P-shot is where we draw your blood, we extract the PRP, the protein-rich plasma out of it, which has your stem cells, your growth factors, your leukocytes. We get that concentrated PRP. I tell patients, if you fall and you scrape your knee, after your knee stops bleeding, that like kind of yellowish clear fluid that forms on top of it, that's PRP. That's what we're going to take right out of your blood. And we'll inject that right into the spongy tissue, right into the erectile tissue. PRP is used to increase nerve growth, and it increases blood flow. So we do a lot of P-shots, a lot of PRP injection in the penis for guys with erectile dysfunction, guys that are having trouble maintaining erections with sensitivity. So both with female genital enhancement, with vaginal enhancements, vaginal rejuvenation, with the penile enhancement, it is a little bit of cosmetic, look, but a lot of it is symptom related. We talk to our patients about what are you trying to achieve with this. I saw a guy from Texas a couple weeks ago, and he was talking about his wife having multiple children, and sex didn't feel like it used to, either because her tissue got stretched out through childbirth, and she talked to her doctor, but she didn't really want to have a procedure. So they talked about it together, and they thought that, increasing the size of his penis was another way to achieve their goals. So he showed up at my office. Just things like that. I talked to a lot of guys about, that have had prostate cancer in the past or having trouble with erections, that don't want to go and get an implant. So it's kind of like you said at the beginning of the podcast. It's just, there's just way more options out now than there were even 3 years ago, to be honest with you.
Yeah, that's interesting that you talked about the prostate cancer. We had a guest on way at the beginning of the podcast. I mean, it's been a few years now, and he came on and told a story about prostate cancer. And part of the discussion was that he had a radical prostatectomy. So if anybody doesn't know what that is, he had prostate cancer. They took his whole prostate out. And that kind of leaves guys at risk for not being able to achieve an erection. And this guy, I mean, he was relatively young. I mean, he was in his 50s and still wanted to date and things like that. And he didn't really have, at the time, I mean, this was probably 2020. He didn't really have any options. I know that those shots have kind of been around for a little while, but just now that somebody who has had prostate cancer and has had their prostate removed and there's some nerve damage there, have you noticed that the P-shot helps that patient or that person?
For sure. Yeah. And we've actually started injecting, well, I use Dysport, not Botox, but we started injecting neurotoxin like Botox and Dysport into the penis too, to basically like relax all that smooth muscle and help blood flow into that area better. So we treat guys post prostatectomy with neurotoxin all the time as well, with good results. It's funny because like I was saying earlier, there's really not a lot of outlet for these types of procedures. If this was something that maybe you were dealing with and you started Googling like what can be done, like there, you come to a lot of hard stops because not that many people talk about it. That's why as much as I think Reddit's like a hodgepodge of a bunch of different shit, like it is nice that there are the one on Reddit, the subreddit's mostly, it's called Getting Bigger. And that's where a lot of my guys go to talk to other guys about these options that are out there. And then there's another website that a lot of guys use called Fallow Boards. And that's just a message board for all things penis related, whether it's ED symptoms or size or, growth, whether it's trying to do stuff naturally or like what I do. So yeah, there's just a lot of new procedures, or maybe not as new, but we're combining them. We're just trying different things, and not with experimental drugs. Like these medicines are very safe. They've been used for a long time. We're just using them in different areas of the body. But I think that's how a lot of the cosmetic world is. Like the Belafil, the the polymethyl methacrylate. It's been FDA approved for cosmetic use since 2007, but before that, it was used in dental bonding and bone cement for kyphoplasty. So, things work for one area and then they trickle their way into the cosmetic field. So, even I had I tore my bicep tendon this summer wake surfing, and I had that repaired, and I put myself on BPC. I put myself on TB 500. I injected my bicep tendon area with PRP just because I have access to the stuff, but I'm not alone in that. A lot of people are, Aaron Rodgers is supposed to play week 15, which is crazy to me. These athletes, these people, they're having surgery, and we're using more of the stuff that's coming out with the biohacking and longevity for repair after surgery. Well, it's just a matter of time before it trickles into helping people look younger, or helping people feel younger. So
that's true. I do have a question about some of the procedures. So obviously, if you're doing, the P shots, or you're doing the neurotoxin injections, the state of the penis doesn't really matter. You're going into that. But when you're doing the cannulas, are you like pulling down on it? Are you wanting them to have an erection for that? Like, what is like kind of how would the injection process go, like physically?
So physically, you would come in. After we would go through all the discussion about the products and go through the whole procedure. Um, I'd lay you down. I do this all while you're awake. We have nitrous if we need it, but to be honest with you, the area that we're injecting is there's not really nerve fibers in there, so it's a very asensitive area. I'll clean you off in that area. I'll use I use lidocaine with epinephrine, and I'll make little blebs in the areas where I need to make my needle ports. I'll poke you with a 25 gauge needle, so we'll make little holes through all those like numb spots. So you will feel the areas where I'm putting I use a Botox needle, so I use a little TB tuberculin PPD syringe. We make those numb spots, and then I'll use that 25 gauge cannula and basically push it through the needle hole and slide it on top of that buck's fascia under the skin and fan that whole area flaccid. So I inject all my penises flaccid. Yes, I will, like kind of have to manipulate it a little bit, stretch out the skin. I inject both circumcised and uncircumcised penises. So if a guy is uncircumcised, then obviously I have to work with a little bit more skin. But we try to, make sure that skin's taut as I'm moving that cannula under there, because I don't want that product to bunch up in any area. So I'll do what I was saying earlier. I'll go around that whole area, the whole entire shaft of the penis, all the way up to the glands with the polymethyl methacrylate, and layer it as evenly as possible. Now, when you leave my office for about the next 2 weeks, you're going to really try to work that product into your tissue. And I am going to have you work it in with erections and without erection. So even though I don't inject an erect penis, I do want you to leave and get erections and try to work that product to make sure it's just as evenly distributed as much as possible with an erection. Because if you don't, and I inject it, when you're flaccid, when you do get an erection, that product will stay where I injected it. So there is a little bit of audience participation when you go home. Like, we're going to have patients manipulate that product as it's settling in there, as it's forming. And then I'd say like 90% of my patients come back in usually 4 to 6 months, and we're touching up any areas where maybe that product didn't take as well. I'd say that for guys, if they're going for like an increase of like an inch in girth or inch and a half, that's about where most of our patients are. They're going to probably need to come in a couple times, usually 2 to 3 times before everything will be even, everything will be settled in there. But it's really, really well tolerated. It takes me about 20 minutes to do the procedure. Like I said, we do it while they're awake. When they leave, their penis is pretty numb because there is lidocaine in all the syringes, and that numbness will last, usually about 40 minutes, 45 minutes. But there's really not an increase, or I'm sorry, there's not a decrease in sensitivity, because we don't really do much with the glands or the head of the penis.
Yeah.
I was gonna say, P shots, and we do glands enhancements, but I do use HA filler for that. I don't use the tissue builder, because it's just way more sensitive, and you don't want to do anything to possibly decrease the sensitivity. We're trying to more increase sensitivity in guys.
For sure. I was thinking, like, Cam, there's no way I'm getting an erection and having Dr. Jason shoot me up.
I don't know. It's like need that like work platform,
You're a nice guy and all, but
have when we were getting ready for the show next week, they have this thing called clone a wiener, right? And it's for like, if you wanted to make your wife a dildo based on your penis, right? So you can buy these things. So I ordered them because I'm like, you know what? I'm gonna have a guy clone his wiener, and then I'm going to inject him, and then have him clone it afterwards, so I can have a real before and after to show people, like. But then, like, you have to stick your dick in this thing of latex for like 20 minutes, and I'm like, who can maintain an erection with their dick in this bucket of latex in our office for like 20 minutes?
Shit.
So I have it sitting on the shelf, but I don't know like how we're going to do it. But that's what I was thinking. I'm like, I don't inject guys with erections, nor do I really want them to get one here and then stick it in this bucket of latex for 20 minutes.
Yeah, like waiting in a room in the corner, like, don't worry about that, Ren. That's just Tommy. He's like doing the thing. Don't worry about what he's got his junk in. It's fine.
Don't pay attention to what's going on behind the curtain, right?
We clone wieners in that room, guys. Leave us alone.
Just once in a while, I'll go bring him a water, because he's gonna get dehydrated with that blood being down there.
I bought a Chevy Tahoe over the summer, and I was at the dealership, like, signing all the papers, and the finance guy's like, what kind of medicine do you practice? And I took my 17-year-old son because I needed somebody to drive my car, the 2 cars home. And we were sitting there, and I said, actually, I make dicks bigger. And then my son was like, oh God, here we go. And he got up and he walked out of the dealership.
That's got to be something like the icing on the cake. Is like every time you have to talk about profession stuff, like your kids are gonna be embarrassed about it.
Oh yeah, especially in my line of work. It's funny. Like I was telling my best friends in OBGYN, and I was telling him today that I saw 3 guys on Monday and 3 guys on Tuesday for male enhancements. And on Tuesday, I was doing it myself because my assistant had to take a sick day. And on like the second or third guy, I was sitting there thinking in my head, I'm like, I can't believe this is where my career's at. Like I would have never thought 10 years ago I'd be sitting here making dicks bigger most of my day, but here we are.
And the Dick Daddy's born.
Yeah.
That's awesome. I guess things don't turn out. I never thought, I didn't even like science when I was a kid, and here I am, a pharmacist. So,
Yeah.
everything kind of just turns and it ends up the way it is. And, clearly you're doing great at what you're doing, and you have a reputation for it. So, I mean, can't beat that.
Yeah, and it's funny, like, and I don't know if you guys are the same way, but when I can start talking about the science behind a lot of these products we use, like all night long, because I get, it's finally like, I was telling somebody that I used to go to conferences when I had a medicine practice, and I would sign into the conference so I get the CMEs, and I bounce in and out of them, or and not really pay that much attention. And now I go to these conferences on longevity, on biohacking, and I'm there for the whole thing because it's so damn interesting. Like it's so interesting where technology is now and where it might be in 3 years, 5 years, 7 years, as far as longevity, the human body, the aging on a cellular level. It's so cool. And you don't want to sound like a nerd, but I guess that's what I am.
No, we're all
Yeah, we
nerds
all have
here.
to be kind of nerds to be at this level. Let's be honest. But like me and Pat definitely do the same thing. Especially me, I'll get into like mechanisms or something like that of some of the medications, and I'll go on a rant. Like we'll talk about it in some of our episodes. We're like, you really can't go too scientific because like the average listener is not gonna like pick up what we're laying down, and then they're like, what the fuck am I doing? I could be talking about to the Dick Daddy about stuff, but here I'm talking about these nerds talking about how GLP-1 agonists work. Like, what the fuck?
Yeah.
If they say that, that's impressive. But
I'll tell you what, on my Instagram, I'll get like a little nerdy on accident, and then I will apologize. But people like that. I feel like people want to hear some of the science behind all this stuff because I guess like you talk about like the GLP-1 agonist. A lot of people heard of Ozempic or heard of semaglutide, but they really don't know how it works. I
I think it's insulin.
Yeah, I feel
Yeah.
like that is appreciated on some level, the science behind it. And that's what we're trained to do is help people make informed decisions to better their health. So
For sure. We try to keep it, we go into it a little bit, but just like once you can just go down a rabbit hole on one thing, and we like to keep it moving. The GLP-1 games, like that's proliferated like crazy. I remember being in pharmacy school, and like I remember just like talking about Trulicity was like kind of one of the first ones, and they're just like, yeah, I mean, some patients have seen with some decent weight loss, and then we get out and like we're out for a year, and you're like,
yeah.
whoa. And just how much. And then other companies have jumped on it and created their own like design specifically for weight loss, even it's kind of in the same class. It's just really crazy how like one pharmaceutical company sees, oh, this is working, and the next thing I mean, everybody's jumping in.
Yeah, it is crazy. And I guess those companies, they're out to make money, so they're gonna exploit any of that. And right now, I mean, that's everywhere. Those products are everywhere. It's crazy.
Oh yeah.
Yeah,
I mean,
it's fucking annoying to be honest. But
I live
It also makes that like whole Ozempic face and stuff is real, right? Like these patients lose 30, 40, 60 pounds. They're going to need some volume replacement because they're going to start looking like an older version of themselves. So, on some hand, it's nice for what I do as well along those lines. Cause, and I think if you have somebody that, is a marathon runner, don't like the way that some of these lines look, they're easy. They're the easiest patients to treat. Patients that just need volume are right up my alley, rather than the patient that comes in that maybe has too much, that are trying to do stuff, and you don't want to add products and make them like they gained weight. So
Yeah, I'm in Hyde Park in Tampa, and it's like a pretty nice area. And I have a plastic surgeon right next door. And then I think a block down, I think there's 3 aesthetics places all in a row. And then a couple blocks down, I have like there's the main strip in Hyde Park. It's like a little it's called Hyde Park Village. And over there's a brand new aesthetic place that just popped up.
oh
And
yeah,
they all like every single one of them is like weight loss here.
yeah,
And it's
Oh,
just like that's their huge pitch. Yeah.
yeah.
Um, and it seems, I mean, I haven't really gone into them and stuff, but like it seems like a lot of them offer somewhat similar services, but every single one kind of has like at least one thing that they do different. But man, that marketing campaign for the weight loss is insane.
That's crazy. It's yeah, it's bonkers right now. Everybody's doing it.
Yeah, especially in Florida.
You know, it's so interesting too. Like Ohio, we're in Ohio. We're not as proliferative like as you guys are, I'm sure, in Florida with cosmetic med spas with practices like that. But on Tuesday this week, I saw my 5th patient from Switzerland, which is nuts to me. You know that they're like I see guys routinely. On Monday, I saw a guy from England. That was his 3rd time he's seen me. Like these, like I'm pulling from not only all over the country, but we pull a lot of guys from Europe to come over for the male enhancements. And you know, cosmetic tourism is like really big right now. You know, so I feel like if patients and you know find somebody that they jive with, whether that's my personality on my Instagram or just my results or talking to other patients, like they don't mind hopping on a plane and going to a different country even. So it's just opened up a whole new world, especially as a doctor. I think as a doctor, you're kind of trained to have a practice and pull from like your county or maybe like a 5 or 10 mile radius of your practice. But you know, I don't know if it's with with Instagram, with social media, with the internet, but the penis enhancement such a little niche market that you know we really have a worldwide audience. It's crazy.
Yeah, it seems like it's relatively new. I mean, we kind of learned about it just doing the podcast. If I didn't do this podcast, I probably would have never found out about it. It's just,
Yeah,
not in my scope. I like getting people off of drugs. I mean, my goal is to get, diabetics down and get their
yeah.
A1Cs lower, get their blood pressures lower, stuff like that. So this was not in my scope, but then just doing this Men's Health Unscripted, I mean, we've learned so much about what's available for men, and
Yeah.
it's growing too. I think when we first started the podcast in 2020, so they sent us home from pharmacy school and we're like, well, what do we do? We figured it out. We started a podcast, and I read an article somewhere that the men's health and wellness space in general over the next 6 years was going to grow like $18 billion.
Wow, that's
And that
crazy.
was in like end of 2020, beginning of 2021. So, I mean, we're kind of getting there, but just what a crazy amount of money that's getting put into it. And like you said, guys, they're not afraid to treat their body like a sports car, invest something if they feel like they need something or they want to go get a service or a treatment, they do the research. And if it's something that they really feel like can help them, I don't think they're afraid to go get it anymore.
No, I don't think so either. And I think that like I mean, I know I'm this way where if you know, I don't mind paying a little extra for a product that might be better for me, that might last longer, that you know won't break down as much. And I think most men are like that. You know, the men, like I said earlier, they're my favorite patients because they're the most informed. So I think it's great, and they're informed because of venues like what we're doing now. You know, which is really nice.
For
that was
sure.
like a big point I was thinking about as well. We're talking about how you have like worldwide patients. A big benefit we have, a lot of people like to shit and dog on our, the American healthcare system and, not arguing there's problems. But the fact of it is we spend like the most money on our healthcare. We're out here doing all this like fast paced research. We have the FDA who is, vetting through research trials, and they're going through all this information to find products, to approve products. Whereas you got overseas, all these countries either don't have medical systems, they don't do research in large scales like we have, and they just really have markets to kind of support that. So producing some of this doesn't really help. Now, yeah,
Right.
manufacturing drugs and stuff different, but like some of this stuff is specific to what we've cultivated in the States. Just the culture as a whole is something where we could benefit this, and we have these outlets. You can't go to some of these
Yeah.
countries and have podcasts to listen to about this kind of stuff because they don't have it.
Right. Yeah, and I'm presenting in 2024 at conferences in Paris, Monaco, Vancouver, and I think Toronto or Montreal. But last year was the first year I went to the Monaco conference just to attend it. It was my first international conference on wellness and longevity, and I was shocked the amount of products that are outside of the US that I never heard about. And on one hand, I was like, wow, that kind of sucks. We can't get a hold of all that. But on the other hand, we can't get a hold of it because the FDA won't allow it. You know what I mean? So to your point, like, it is great, I think, practicing in the United States, that we have a body that really watches out for patient safety for, by and large, the most part. And if we have products here that we've been using for 20 years, they're safe because there's a lot of data on them. As opposed to some of these other countries like Korea that has different products every month that are coming out, and I don't know that they're vetted as well as they are here. So I get we get all those questions a lot, and that's why I do tell patients that yes, even though these products are new to you, they're not new to us. We've been using them for almost 20 years, and then before that they were using them in the body for something else. So there's a lot of data behind these products now.
Yeah, and it's definitely like a double-edged sword, because like our analogy here with like the car parts, like, yeah, getting the brand new Holley Sniper, fuel injection kit sounds really great, but like if you've never heard or don't know anybody who's tried it or has no data on its application on your car specifically, you could just be writing a check for disaster that's going to happen. Whereas at least through some of our processes here, not really cheering for three-lettered organizations in the government, but some benefit does come from that, and that vetting does show some application to your particular model, and if it shows benefits, it's going to be allowed, and then you're going to get a product you're spending money on that's going to work for you and be safe.
Right, yeah. And especially if you're talking about injecting that into your dick, you want to make sure that it is those things, right?
Oh yeah, because you hear about it all the time with like illegal drugs. People are getting heroin and injecting it, and it's like laced with fentanyl and shit, and all this like weird stuff you hear on the internet and the news. Like, it's the same thing with medical drugs in some other countries as well. Like, you'll get something and it's got more lactose fillers in it than it should, or it's got other bulkers in it that just cause reactions or even can cause death, things like that.
Oh yeah, I mean, I think that the classic like Colombian boob job BBL thing that people fly people fly out of the country to go get like the cheap big butt type thing, and then they end up and they're like, oh, I got this like massive infection and lost my butt. And it's like, well, what'd they use,
Yeah.
and all kind of crazy stuff. But people are flying from out of the country for Dr. Jason.
Yeah, and it's way more prevalent than I realized, because we'll have a lot of patients that'll call and ask us if we inject these certain products, and I'll look them up and I'm like, no, they're illegal in the US to inject that into something. They've been getting it in Colombia, or they've been getting it in Tijuana or whatever. Like, it's so yeah, you have to, I don't know, like, if I was going to get something injected in my body, I feel pretty good that we're in the United States getting that injected into our bodies.
For sure. The chances of the risks are a lot lower. I think the standards are a lot higher. The cleanliness and all that kind of stuff is just, it's a lot better, here, than what you deal with overseas.
Yeah. And with the, getting back to the male enhancements, not only do I inject a lot of penises, but the products that we inject in penises, I inject the most, like I said, worldwide for the past 4 years. So I think that puts a lot of guys' minds at ease. Not only are we pretty proficient in injecting it into that area, but we work with this product so much. We've really heard everything that can possibly, bother somebody, and we know how to deal with complications, and we know how to deal with really every question that gets asked. So that comforts a lot of people as well. So there is something to say about expertise in a certain field, I guess.
Awesome. Well, as we kind of wind it down a little bit, Dr. Jason, I got to ask, what is your favorite procedure to do? Maybe of all time, maybe your top two, something like that.
So I think that I do like a non-surgical mommy makeover really well. So that's, if you had asked me my favorite procedure, that's it. It's liposuction with skin tightening of the belly and flanks, skin tightening tightening and contraction of the breast and then moving that fat up to the breast. So I do that probably on, 3 times a week. That's probably like my favorite procedure in general. Getting back to what I was saying earlier from a business perspective, it's obviously the male enhancement because it's quick, it's easy, it's tolerated really well. Everybody likes it. Those are probably my 2 procedures that I try to, spend my time doing in my office. And outside of that, I do rejuvenation really well. I do full face, like we were talking about at the beginning with the collagen stimulators. And so my procedures are a little bit bigger. I have a staff of 18. I have 3 other injectors that do the smaller things. And so I kind of have whittled my space into those procedures.
Dr. Jason, if you don't mind, I'm going to call you the international Dick Daddy now because you got people flying in for you. You're speaking overseas. It's really cool to see like how you're growing and kind of what you're doing and really helping guys. I know you work with women too, but it's men's health, but how you're helping guys get their confidence back that they've lost. I mean, the example with the guy whose wife had a couple kids and she might have been a little more stretched out. I mean, that can probably, you might have saved that guy's marriage and not even know it. I mean, things like that can really improve a man's confidence and just their relationships. And, giving we've noticed that giving guys the ability to have sex and have quality relationships and build that is just so fruitful for them. So thank you for doing that.
Yeah. I appreciate it. Just like as we're winding down, I'm the one that answers like all the social media stuff and things like that as well. I don't have a manager for that. So if you have guys that are listening to this to have more questions, they can feel free to reach out. I'm pretty accessible. And if not, Christine at my office, she's my patient coordinator for all my male procedures. We can get them in touch with her and she can answer any more specific questions. And like we were saying earlier, there's a lot of options out there. It doesn't have to be just, straight inject these biostimulators. We do a lot of work with stem cells, with steroids, with hormones, with other things like that. So
awesome.
That was definitely going to be one of our next questions. Like, where can everybody find you at? Like your social media handles, and then your office again.
Yeah. So I mean, most of this procedures and what we talked about today is all on our website. It's www.youthologymedSpa.com, or my Instagram handle and all my TikTok. Everything's Youthology Medspa. So they can find us there. And like I said, I answer all those questions, and then I have body and patient coordinators for all my male stuff at my office. So
awesome.
But we can probably include all that information on this somehow. So
yeah, I'll include everything in the description. We'll take care of that so everybody knows where to find you if they're seeking this information from this podcast. You'll be easy to get a hold of.
Yeah. Well, I hope this was informative, and like I said, I had a good time, and this was great.
Awesome. Yeah, we definitely learned a lot. I mean, we've heard about these procedures, but I really think that you dove in probably more so than anybody and really kind of described exactly what happens. There are some differences. I think every doctor probably does it a little bit different, and there's probably, some different differentiation in the protocol, but, thank you so much for like really clearing that up. And then just finding out what a visit with someone that's going to work with you for aesthetics is like. I mean, you really detailed that really well. Kind of how you're going to talk to the patient and kind of just the steps. So it's very comforting knowing that you're out there, really caring about your patients.
Yeah, I appreciate it. And since we're seeing so many people from out of town, I do have a secure email server for, that's HIPAA compliant, that, when patients start the process, by the time they get to my office, we have conversed a lot, before they even meet me. So we do make the procedure and the visits as personal as possible because, let's face it, people are spending a lot of money. We want to make sure that they're comfortable with every step. So
awesome. Well, Dr. Jason Rupeka, the Dick Daddy, International Dick Daddy, we're super excited to have you on the show, and we'll talk to you soon. You're welcome anytime.
I appreciate it. Thanks, guys.
Thank you.